Shakira,
Eugenia.
Kwame.
And today we'll be talking about health promotion education, specifically STDs. What are STDs? They are sexually transmitted diseases, which are infections that are passed from one person to another through sexual contact. They're normally caused by bacteria, parasites, and yeast and viruses. For example, STDs can be HIV, chlamydia, genital herpes and warts, and so on and so forth.
According to the U.S. Center for Disease Control and Prevention, STI rates are on a rise, especially among the youth, and that's why we choose the youth for our audience. Now, the UN for Statistics and Consistency across regions defines the youth as persons between the ages of 15 and 24.
Health promotion. In this presentation, we decided to show the youth how to take care of themselves and live a healthier life. So keeping people healthy is one of the our goals, which is teaching them how to eat better and all, empowering individuals to healthy behaviors, having a balanced diet, exercising, and all that, making changes to reduce the risk and of developing chronic diseases. Also in the category of diet, and also having vaccinations for certain diseases at birth and all that, and educating people about eating healthier. Disease prevention also, it also falls under the promotion of a healthy living, educating with the individuals about the modes of infection, which are the ways in which an individual can attract an infection or disease, educating on diseases and their implication, diseases, their symptoms, what they do, possibly kill you, and how to take care of themselves in the sense of hygiene.
Okay, so let's talk about the modes of transmission. These are basically ways in which diseases are transmitted from one person to another. So the first one is sexual transmission, and it includes genital anal, genital oral, all those things. Then the second one is skin to skin contact, and this includes things like kissing. It includes things like kissing, non-protective sex, body rubbing, and so on. Then mixture of infectious body fluids such as blood, semen, vaginal secretions, and so on. Then also sharing of needles and other sharp objects such as razors, blades, knives, all those objects. Then mother to child transmission, and this may include, and it involves the birth process. During birth, a child may be able to get infected because of the exchange of those fluids, the blood and all that. Then also a mother may also be able to transmit these diseases through breastfeeding, through the milk. Then also we have infestations such as scabies and pubic lice. Then the symptoms of these STDs may include bumps, sores, then swelling or redness near the penis or vagina, then skin rash, then painful urination. When someone is during that process of urinating, they may face some difficulties or feel pain. Then yellowing of the skin, which is also known as jaundice. Then discharge from the penis or vagina, which may have an odor. Then also bleeding from the vagina other than the monthly period for the ladies. Then also painful sex.
So we'll be discussing two diseases, basically HIV and syphilis.
HIV stands for human immunodeficiency viruses that target and alters the immune system, increasing the risk and impact of other infections and diseases, which also include cancer. AIDS is the most advanced stage of HIV. Once it develops, to AIDS, infection and disease become more prone and with a greater risk of getting infected. The causes of HIV could include body fluids, semen, vaginal secretion, anal fluid, and breast milk.
Pathway of HIV when it affects an individual. So first, it's your mode of transmission, how you attracted it is the first one. And when you get HIV, it first attacks the CD4 cells in your immune system. These cells are the ones that detect viruses, diseases, and battle them so you don't get sick. So when you're infected with HIV destroys these cells, leaving your immune system like a defenseless system. And it goes through your blood and it affects your respiratory and cardiovascular system. When you have HIV, you're prone to a lot of diseases like cold, flu, pneumonia, tuberculosis. And due to getting all these diseases, the lungs get weak, leaving the lungs bare or the word to use, defenseless for lung cancer. And also cardiovascular system, it affects the pulmonary artery, which it blocks it. So which is the artery that takes blood to the lungs. And when that happens, also the lungs is not getting enough blood to function properly. And the digestive system, when the HIV cells affect the digestive system, it creates a difficulty, or it affects the digestive tract, which creates difficulty and loss of appetite and difficulty to eat properly. And we move on to the nervous system. HIV cells don't really affect the nervous system. They affect the cells that support the nerves around the nervous system, the brain, and also and the body as a whole. And finally, integumentary system, which is the skin. The patient experiences rashes, eczema, and sores on the skin.
So the next disease is syphilis. So syphilis is a highly contagious disease caused by a bacterium known as Treponema pallidum that spreads primarily by sexual activity, including oral and anal sex. It is spread from sores of infected people. So although the disease spreads from sores, the vast majority of these sores go unrecognized. That is to say that a person may spread this disease from a person may spread it may be unknowingly passed on. A person may spread this disease to their sexual partner without being aware of having the disease itself. Then the next one is breastfeeding mothers can transfer the disease to their children. Yeah. Then the pathway of syphilis.
Okay, so for the pathway of syphilis, like she said, the syphilis is caused by Treponema pallidum. Now it gets to an infected person through the blood fluids, where it gets to the blood fluids through cut mucous membrane, sexual contact like oral. It can also get to a person through the direct contact with skin lesions. Now from the body fluids, it moves to lymph nodes where it causes lymphadenopathy, that is enlargement of the limbs. From there it moves to the limbs and then to the blood where it causes spirochetemia, which is the presence of spirochetes in circulating blood. And then it moves to the endothelium cells near the skin where it causes an itchy skin rash or small bumps. And then to organs. Then before it moves to organs, it can also move to parts of the body like the skin or the sole of the feet itself, and then to organs and tissues like the heart, the brain, liver, and joints. So the body systems that are affected are the cardiovascular system, the nervous system where we can have the nerves, skeletal system where we can have bones and joints, reproductive system where we can have the female or male reproductive system, and then the digestive system, basically talking about the liver.
Then prevention and control of these STDs. So know your HIV status.
So you have to know your HIV status so when you know your HIV status, you know that you are not transmitting the disease or you are protecting yourself from acquiring the disease.
And abstain or practice protected sex.
So you have to abstain because it's the best way to stay away from STDs, or practice protected sex by using latest condom to prevent attracting the disease or spreading the disease.
Avoid sharing towels and underclothing.
Since STDs can be transmitted through body fluids, sweat, individuals who wear clothes and all take a shower and wipe their bodies with their bodies dry with these clothing, or wear clothing where they've sweat into, and you wear them, you are more likely to attract these diseases.
Avoid sharing sharp objects.
Sharp objects like needles, blades, sharing needle used for drugs or in any other purpose can transfer HIV from an infected patient to another, which should never happen in the first place. So it's another mode of transmission.
And get vaccinated for hepatitis B.
Now you have to get vaccinated because hepatitis B itself is a sexually transmitted disease. So once you have the vaccine, then you know that you are not acquiring the disease.
You will not be prone to the diseases. In the treatments,
most STDs don't have cures for them, but then it's possible to treat the symptoms that the patient is experiencing. With HIV, there are antiretroviral drugs for those, and there are other ones too. So antiviral drugs for genital herpes, hepatitis B, and antibiotics given orally or by injection for gonorrhea, chlamydia, and also syphilis, and other STDs too. Thank you.
so that's how we
that's how we are free.
Yeah, for where we got our information. Practice safe sex.
Thank you.
Thank you.
Thank you.
Oh, hi. How are you? Okay, so how are you doing? Of course, you are not fine, I'm guessing.
No, I'm not.
How are you feeling?
Doctor, I'm not fine. I don't know what's wrong with me, but lately I've been feeling nauseous. I've been vomiting. I have some rashes, and I do not really understand what's happening to me. Of late, I've lost so much weight. I'm not sleeping. I have sleepless nights, doctor. I'm not feeling fine. I don't know what's wrong with me.
Skin rashes.
And also, of late, I've also been noticing that I'm getting some sores in the mouth.
Have you been losing any hair? Experiencing headaches?
Yeah, a lot of headaches.
Okay. Muscle aches?
Yeah.
Okay. Alright, have you had unprotected sex lately?
Yes, doctor.
Okay. Alright. So we're gonna, for now I'm going to give you some medication for your headache and your other symptoms, and I'm gonna conduct some tests to see what's wrong with you, alright? Okay.
Thank you.
Come on. Alright, have a seat. Okay. Let me see if your results have been sent to me. Oh, there they are. So, well, you have syphilis.